Rhode Island has hit another grim milestone. Today, the Department of Health says the state has surpassed 100,000 positive COVID-19 cases. Sadly, another 31 people have died from the virus since Friday, bringing the state's total number of deaths to 1,947. But doctors say help is on the way. Let's send it over to 12 News reporter Brittany Schaefer, who has an update on the state's vaccination efforts. Brittany.
The Department of Health releasing Monday, the state has given more than 35,000 doses of the vaccine. This coming close to a month since the first vaccine was given here.
More and more vaccine available.
The Department of Health says the biggest challenge with vaccine rollout is not getting enough.
We're just not getting a lot of vaccine from the federal government.
Rhode Island is slated to hit more than 50,000 COVID-19 vaccine doses received. This as another 14,000 dose shipment is expected to arrive Monday. Department of Health spokesperson Joseph Wendelken tells me around 2,000 people a day are getting a shot.
We administer in a week the amount of vaccine that we get in a week. We have the infrastructure in place. We have the systems in place to vaccinate much more people, many more people than we are vaccinating now each week. So we're ready to go.
Wendelken says Rhode Island currently has one of the highest immunization rates per capita in the country. At the end of January, he tells me outpatient healthcare providers like dentists will be eligible to get the vaccine. The Department of Health is keeping a close eye on the AstraZeneca vaccine, which would offer the state more COVID-19 shots. Either way, Wendelken says doses should ramp up soon.
As time goes on, more vaccine will become more available, but at this point, with such small amounts of vaccine coming into Rhode Island each week, we really have to be extremely judicious with where vaccine is getting distributed to. We understand that people are very eager to get vaccinated, and that's a good thing.
And out of the 35,000 doses that have been given, 4,600 of those have been second doses, meaning the person is fully vaccinated. Coming up new at 6, how the Department of Health says the vaccination timeline is going. For now, I'm Brittany Schaefer, 12 News.
Everyone's hope is riding on the ongoing vaccine rollout, which many say is not happening fast enough. 12 News reporter Brittany Schaefer checked in with the Rhode Island Department of Health today to get an update on the state's progress.
The Department of Health tells me another shipment of the vaccine is expected to arrive in Rhode Island any time now. Spokesperson Joseph Wendelken says the state receives around 14,000 doses every week. As the state hits another grim milestone in COVID-19 cases.
It's a reminder about how important it is that we still continue to take those basic prevention measures.
So does vaccinations. More than 35,000 have been given in less than a month, 4,600 of those a second dose.
We administer about 2,000 doses a day. So generally speaking, we administer in a week the amount of vaccine that we get in a week.
Select populations, including healthcare workers in high-risk settings, first responders, and nursing home residents and staff have gotten the vaccine. Department of Health spokesperson Joseph Wendelken says for the most part, people have been receptive to getting the shot with no major groups of refusal. At the end of January, Wendelken tells me outpatient healthcare providers like dentists will be eligible to get the vaccine. He says the state's vaccine rollout timeline is where they expected it would be.
We anticipated that early on for these first few weeks that there would be limited amounts of vaccine available. So that's why we did that really careful phased approach to making vaccine available.
Wendelken says Rhode Island currently has one of the highest immunization rates per capita in the country. He says the biggest challenge with vaccine rollout to date is not getting enough from the federal government.
I understand that people are very eager to get vaccinated, and that's a good thing. You know, the demand for vaccine is a very good thing. We wish that we had more vaccine available than we do, but we're doing our best with what we have.
And Wendelken says the state does have the infrastructure and systems in place to be able to handle more vaccine, adding hopefully more is coming in the next few months. I'm Brittany Schaefer, 12 News.